And welcome back. It's Medical Monday, and we're talking about Makoplasty or knee resurfacing. And East Cooper Medical Center is the ABC News 4 hospital expert. And joining us now is Dr. Brody E. McCoy.
Yes, ma'am.
Thank you for joining us. And of course, whenever we have doctors, especially talking about knees, I have a little knee problem. I wouldn't have to have Makoplasty, you think?
I don't think you're a candidate for Makoplasty.
Okay, good.
So.
Well, let's talk about that, being a candidate. Who would be a candidate for it?
Well, somebody that has arthritis that's limited to one or two compartments of the knee. The knee is composed of three compartments. There's a medial compartment or an inside compartment, a lateral compartment, and then a compartment underneath the kneecap. If it's localized to one or two of those compartments, then you'd be a candidate for Makoplasty. Okay. There's a lot of conservative management that we can do for knee arthritis that works extremely well. But for those who fail the conservative measures, and traditionally what has been done is a total knee replacement. And what a total knee replacement is where we go in and resurface the entire knee, which is a very good procedure to do, a very successful procedure, but it's much more invasive than Makoplasty.
Yeah. Now, what are some of the symptoms to let you know that you would need a procedure like Makoplasty?
Sure, that's a great question. Stiffness is a big symptom that people have, as well as swelling and pain that limits activities of daily living. There are over 80 million Americans that suffer from osteoarthritis in the knee, and these are the symptoms that they have. Okay.
Now, how is this procedure performed? Because when you hear resurfacing, to me that sounds like you go in and there's some type of scraping involved.
Sure.
That's what it sounds like to me. I don't know.
Yeah, sure. There is some removal of damaged cartilage and bone that's done. So in a Makoplasty, when the patient comes in to see us in the office, we take some plain x-rays and we do a history and physical to make sure they're indeed candidates to have the Makoplasty done. If they are, we talk to them about the procedure, and then we obtain a CT scan or a CAT scan of their knee. And from that CAT scan, we can make a three-dimensional model on the computer. And on that three-dimensional model, we can actually virtually perform their surgery as many times as necessary before we ever get to the operating room on the computer. Oh. So we can size different components. We can, on the computer program, remove different amounts of bone until we get what we call the sweet spot, which is the exact amount of bone that they need removed to have the joint replaced. So we'll know preoperatively what their range of motion is going to be like after surgery, and what the stability of the implant's like. So we know all that going in. So then the day of the surgery, we're able to make the incision and go in. And in comparison to a total knee, there are no ligaments that are cut. The ACL and the PCL, which are the two big ligaments that help stabilize the knee, those are removed in a total knee replacement. Whereas in a Makoplasty, those are left intact, as well as the remaining normal cartilage. So we don't take any of the normal cartilage, we just take the damaged cartilage out. And the way that's done is, once we obtain a three-dimensional model on from the CT scan, we have a robotic arm which comes in, and we're able to program that data into the robot. So the robot comes in, the surgeon is controlling the robotic arm, but it will not allow you to cut in areas where you shouldn't cut. And the accuracy or precision of the Makoplasty is within a half millimeter. Well, the thickness of your hair is a millimeter. So the precision is unheard of.
Wow. So when you're is this in a hospital setting, a clinical setting, and what's the downtime?
Sure. It's a great question. It's done in the hospital. It's done. You could potentially do it as an outpatient, but the vast majority of our patients stay one night just to get antibiotics after surgery, to make sure they're doing well, but one night stay in the hospital and then they can go home. They're doing stairs the first day of the day of surgery. So you have the surgery done, your partial knee resurfacing, and doing stairs the same day, and then able to go home by the next day.
Wow. So are there any other procedures out there like that they can opt for, or is this the new cutting edge?
This is kind of cutting edge right here, and what's traditionally been done is a total knee. Well, again, a lot of people that are getting total knee replacements are indeed candidates for Makoplasty. So the downtime is about 50% of what it is with a total knee. So total knees usually stay in the hospital for 2 or 3 days. Again, Makoplasty is about a day in the hospital. Going up the stairs same day of surgery.
And that sounds like a pretty good option right there. Well, Dr. McCoy, thank you so much for joining us.
Thank you for having us.
And it's good news that I don't have to have Makoplasty done, but I need to come see you. Thank you so much.
All right, thank you.
And remember, you can visit our ABC News 4 Experts page for more information from East Cooper Medical Center. That address, abcnews4.com/experts. Much more Low Country Live coming up after the break, so stay with us.